HIV, or the human immunodeficiency virus, is one of the most researched yet feared infections of the modern world. Unlike common viruses that the body can fight off, HIV directly attacks the immune system, specifically targeting CD4 cells, which are the body's natural defenders against infections. Over time, without treatment, HIV weakens the immune system to such an extent that the body becomes vulnerable to illnesses that would normally be easy to fight, such as pneumonia or even common flu. The virus progresses through three main stages. The first is acute HIV infection, which happens within 2 to 4 weeks after exposure. During this stage, people may experience flu-like symptoms, fever, sore throat, or swollen glands, though many may feel completely fine, making the virus hard to detect early. The second stage is known as chronic HIV infection or clinical latency. Here, the virus is still active but reproduces at low levels. A person may not show symptoms for years, yet they remain infectious. The third and most severe stage is AIDS, acquired immunodeficiency syndrome. This stage is diagnosed when the immune system is badly damaged, and CD4 cell counts fall below a critical level. At this point, the body can no longer defend itself effectively, leading to life-threatening infections and cancers. Without treatment, people with AIDS typically survive only about 3 years. However, with today's medical advances, timely use of antiretroviral therapy, ART, can prevent HIV from progressing to AIDS, allowing patients to live long, healthy lives. HIV spreads through direct contact with certain bodily fluids of an infected person. The most common fluids responsible for transmission are blood, semen, vaginal fluids, rectal fluids, and breast milk. Unlike casual contact such as hugging, shaking hands, or sharing food, HIV requires the exchange of these fluids to be passed from one person to another. The two most common routes of infection are unprotected sexual intercourse and sharing contaminated drug needles. During unprotected sex, tiny tears in the mucous membranes allow the virus to enter the bloodstream. Similarly, when people share needles, even a microscopic trace of infected blood can carry enough virus to infect another person. Other possible, though less common, ways include transfusions with contaminated blood, rare today due to screening, or from mother to child during childbirth and breastfeeding if preventive measures are not taken. It is important to highlight that HIV is not transmitted through air, water, saliva, sweat, or casual touch. This knowledge helps reduce stigma and prevents discrimination against those living with HIV. Prevention remains the most powerful tool in the fight against HIV. Using condoms correctly and consistently during sex drastically reduces the risk. Avoiding the sharing of needles is equally critical. In medical settings, sterilized equipment ensures safety. Additionally, people at high risk can take pre-exposure prophylaxis, PrEP, a daily pill that significantly lowers the chance of contracting HIV. For pregnant women living with HIV, proper treatment can almost eliminate the risk of passing the virus to their baby. Through awareness, safe practices, and medical advances, the global community continues to fight HIV, working towards a future where new infections are rare and living with the virus does not mean a life cut short.